Bloomberg Audio Studios. Podcasts, radio, news.
Healthcare in Nigeria is under the spotlight after the death of author Chimamanda Adichie's 21-month-old son.
This kind of tragedy is a symptom of a systemic failure. It demonstrates that there are either lapses or absence of patient safety systems in place. There are lapses in accountability, transparency, and credibility.
Nigerians are asking if this is the latest example of an inadequate health system, with many wealthy citizens seeking care abroad.
This one is only seeing the light of the day because it happened to somebody that has a voice. How about those thousands and millions of people that are voiceless?
On today's episode, we'll look at what this tragedy says about the state of Nigerian healthcare and how it compares to other countries on the continent. I'm Jennifer Zabasajja, and this is the Next Africa podcast, bringing you one story each week from the continent, driving the future of global growth with the context only Bloomberg can provide. In a moment, we'll speak with Bloomberg senior reporter Yinka Ibukun and our healthcare reporter Janice Kew. But first, a little more on the tragic incident itself. The governor of Lagos State has launched an investigation into the death of Chimamanda Adichie's 21-month-old son. He said the investigation will examine the allegations raised, including compliance with established clinical protocols, professional conduct, patient safety standards, and the roles and responsibilities of all parties involved. He added that any individual or institution found culpable of negligence, professional misconduct, or regulatory violations will face the full wrath of the law. I want to bring in a conversation with Anthea Esege-Nwandu, Chimamanda Adichie's sister-in-law, herself a practicing doctor. I asked her to explain what exactly happened to her nephew.
The negligence happened following or during administration of IV sedation with propofol. He received, per the medical director, too much sedation. And on my interview with the anesthesiologist, he was transferred without any form of monitoring. He was also transferred without oxygen, which he required not only during the procedure, but also during transportation. The neglect to monitor him happened during transportation, and that most likely led to his cardiopulmonary arrest. At a time, we're not sure because we don't have any records at this moment.
And you actually said you don't want to see your nephew's death to happen in vain.
Yes.
What does that look like for you and for your family?
So first of all, that looks like accountability. In any healthcare system that has patient safety systems designed and in place to prevent harm, negligence, adverse outcomes like this unfortunate one are accounted for. And accountability means transparency, investigation, learning, having systems in place to prevent harm, and if harm does happen, to detect it early and escalate care rapidly. So it starts at the hospital, but it's at multiple levels where we want to see systemic reforms instituted and enforced in the healthcare system at multiple levels.
And just finally, Dr. Nwandu, I wonder if there's any other message that you want the public to know about your nephew and about your family.
Yes. My nephew's death is, as we all know, a personal and horrific tragedy. But it's an unacceptable cost. Patient safety science is well established. What Nigeria requires now is the political will of the government, regulatory courage to stand up and speak and publicly declare what they find, public demand for accountability. And when those key issues align, meaningful reform is absolutely achievable in Nigeria. So I'm looking forward to reform, and I'm looking forward to transparency, and I'm looking forward to the political will that will supercharge these activities.
So, Yinka, perhaps we start with you. We just heard from Dr. Nwandu speaking as a grieving aunt, as a public health leader, and also a patient safety advocate. When we think about what the hospital has said in response to this specific incident, what have you found based on your reporting?
Thanks, Jen. So first of all, my condolences to the Esege-Adichie family. We did try to reach out to Eurocare multiple times for comment. They did not respond to Bloomberg's request, but in a statement quoted in local media, they expressed sympathy over the family's loss and noted that the child had arrived at its facility in critical condition. They also said that they were investigating internally, and Lagos State has also launched a probe into the cause of death of Nkanu. There are reports that the doctor accused of wrongdoing has also been suspended.
And Dr. Nwandu was just speaking there about accountability and transparency, which speaks to the investigative manner in which we're seeing this play out right now. But Yinka, this is obviously a tragic individual case. But when we zoom out and look more broadly about the healthcare industry in Nigeria, are you noticing more of the population calling for some of these changes that we just heard from the doctor there?
Stories of medical negligence have actually flooded social media since the incident, and these stories are sadly very common. They've impacted my own family as well. And usually such incidents boil down to infrastructure gaps like unreliable electricity for medical equipment, or hospitals running out of oxygen or blood, or not enough healthcare workers. The facility that we're talking about here wouldn't have been expected to have any of these problems, but these are the systemic problems faced in Nigerian healthcare. And in addition to that, from the healthcare perspective, it's been worsened by the brain drain. A lot of Nigerian doctors and health professionals go abroad to seek better conditions. And then on top of that, accountability is low. So when incidents happen, few people have the resources or even the faith to seek redress or pursue legal action. And what people are asking for is harder because at a systemic level, again, there's so much that needs changing. But if I can boil it down to two things, I would say first is that there should be more stringent and enforced standards around patient safety. A doctor told me that policies that would keep patients safe exist, but often they aren't mandatory. And the second thing would be really accountability when harm happens or when a life is lost. In developed countries, incidents like this would have triggered automatic investigations. All patient records would be logged and examined. Here, the family had to serve the hospital to ensure the documentation was preserved. So for all these reasons, there's a lot of systemic change that needs to happen, and many Nigerians are watching. Hopefully we'll be joining in ensuring that that does happen, because if a tragedy like this in such a high profile situation doesn't trigger change, the worry is what will.
Yeah, and I wonder, Yinka, why you think this has triggered such a shock. And as you mentioned, messages flooding on social media. Have you seen something like this before, or does it seem potentially like this could be a transformative moment?
So unfortunately, these tragedies happen often, but this is particularly resonant for a few reasons. First, who it happened to. Chimamanda Adichie is a global star. Her writing has given language to experiences as Africans, as women, as mothers. She's even written about grieving as a daughter, her father's death. And her husband, Dr. Anthea Esege, is a medical doctor himself. So they could access the best care, and if this can happen to them, Nigerians are thinking it can happen to anybody. But it's also where it happened. We know very well the failings of the Nigerian healthcare system. But when we think of that, we're not including places like Eurocare. That's a top-tier private hospital. However bad the situation in Nigeria is, many people would have thought that a hospital like that would somehow have been insulated from it. And then finally, it just strikes a chord because we're talking about the loss of a young child. As heartbreaking as this is, there are way too many parents in Nigeria, which has one of the highest child mortality rates in the world, who live with that pain. Approximately 1 in 9 children die before the age of 5. And these deaths disproportionately affect the poor.
It's completely heartbreaking, as you mentioned. Stick with us, Yinka, and Janice, you're also here. We're going to continue the conversation after the break and talk about more of what's happening within Nigerian healthcare and potentially what outlook there could be for any improvement. We'll be right back. Welcome back. Today on the podcast, we're discussing the state of healthcare in Nigeria. Yinka Ibukun and Janice Kew are still with me. Janice, let's bring you into the conversation. What do we know about the healthcare system in Nigeria? You cover this extensively and have been. Yinka was just giving us some insight into her own viewpoint and reporting on the industry. But talk about how it is compared to some of the other healthcare systems within the continent.
And Yinka, if I can just say, I'm very sorry to hear about your personal losses and tragedies related to the healthcare systems. Healthcare investment in Nigeria is low by global standards, with high individual out-of-pocket costs restricting access to care. For regional context, West Africa is home to 16 countries, with a combined population of more than 430 million people. More than half of those are living in Nigeria. But even within the region, Nigeria's healthcare system lags behind many of its West African neighbours. Primary healthcare remains very underdeveloped in Nigeria. As Yinka said, there are health worker shortages. Late last year, Nigeria said about 67% of locally trained doctors currently work abroad, primarily in the UK. That's driven by better working conditions and economic opportunities abroad. But that obviously further restricts access to care and reduces the quality of care for large parts of the population. In a study that was published by Lancet in 2022, it showed that Nigeria's health spend increased from $18.6 per person in the whole of 2001, which made it the 11th in West Africa, despite its size, to about $84 per person in 2018. That raised its ranking to the 3rd highest in the region. But despite that increase in spend, relative outcomes remained really poor. Nigeria still ranked 6th in West Africa for age-standardized mortality and 7th for healthy life expectancy.
Which is so surprising, especially if you think of the expertise that comes out of a lot of the medical schools and the medical students that are Nigerian. But if we just focus in on medical tourism, that is something, Yinka, you brought this up, that we have continued to see all across the continent, but especially too with leaders. Janice, maybe you start with us. Expand a little bit more on how big of a trend that is.
The trend of Africans seeking healthcare abroad is significant. Some estimates put it at about 300,000 Africans that travel to India annually for medical services, spending more than $2 billion each year. You mentioned leaders. We've seen several African presidents travel abroad for health services. That reflects the ongoing challenges in their local healthcare systems. Just to name a few, we had President Buhari from Nigeria. We've had President Lungu from Zambia, President Mugabe from Zimbabwe, who died in Singapore in 2017 while seeking medical treatment. We've had President Bongo from Gabon, who suffered a stroke and was treated in Saudi Arabia after that stroke. And we've had President Talon from Benin, who traveled to France for treatment in 2017.
Janice, maybe let's speak to some of the other problems that we are seeing within the healthcare industry in other pockets of the continent. What sticks out to you when you're looking at this from your vantage point?
On a continent like Africa, as you can imagine, healthcare varies widely. Certain regions face high endemic infectious disease risk and the related burden to that. But we do see certain pockets faring better than others. So in Kenya and South Africa, the healthcare systems, which are also a mix, like in Nigeria, of public and private sectors, they both spend a lot more of their GDP on healthcare than Nigeria does. Nigeria allocates less than 5% of its national budget to healthcare. and that is significantly below the 15% target recommended by the African Union. In Kenya, there is mandatory health insurance. That's something South Africa is working hard to also introduce. Just to be clear, Nigeria also has compulsory health insurance, but previous efforts at universal coverage have failed to achieve significant population coverage. The health insurance system remains very fragmented there, and some estimates peg the percent of Nigerians that are still not covered by any form of health insurance at 90%. That means 10% of Nigerians are estimated to have health insurance. That compares to about 16% in South Africa, although in South Africa, that's changing as lower price packages are offered, health insurance packages. And in Kenya, about 53% of the population have health insurance. So that puts it in perspective, not only from a GDP spend, but also in terms of universal coverage.
Yeah, and we're seeing some laws changing, at least in South Africa, or at least being debated as it pertains to health coverage. Yinka, maybe we just finish with you. One point that stuck out to me from what Dr. Nwandu was saying was the question is whether or not Nigeria has the political will. Have we had any indications from this administration that potentially we will see some reform to the healthcare industry moving forward?
When we look at patient safety, I think it's going to take some time before we see real talk about reforms. But Nigeria does have a minister, Dr. Mohammed Pate, who has been trying to drive reforms specifically at the primary care level. And the hopes is that the discussion on patient safety standards will reach those reforms, even if it only starts with primary care. So that's the hope out of this. But it's also important to note that, as Dr. Nwandu said, they're taking up this fight amid unimaginable loss. And so it's really important that, we do see something happen in terms of reforms that impact the wider population of Nigeria, which is why it's so important that policymakers come into this.
Janice and Yinka, thanks again so much for joining us this week. And you can read our reporting of healthcare across Africa on Bloomberg platforms now. Here's some of the other stories we've been following across the region this week. Mozambique will only start talks with creditors to renegotiate its debt after reaching an agreement on a new program with the International Monetary Fund, President Daniel Chapo told Bloomberg in an interview. The gas-rich southeastern African country is in talks with the IMF on a new facility to stabilize the economy, curb its reliance on natural resources, and restore investor confidence. And South Africa's government welcomed the approval of a U.S. preferential trade deal before a key vote in the Senate, where Pretoria has faced opposition to its continued inclusion in the pact. The House of Representatives approved the 3-year extension of the African Growth and Opportunity Act, also known as AGOA, which expired in September. And you can follow these stories across Bloomberg platforms now, including the Next Africa newsletter. We'll put a link to that in the show notes. This program was produced by Adrian Bradley and Tiwa Adebayo. Don't forget to follow and review this show wherever you usually get your podcasts. I'm Jennifer Zabasajja. Thanks as always for listening.